In this film, we hope to address the question of help and support. Sometimes personnel can have worries about seeking help, and families and friends don't wish to rock the boat. Help is at hand, and it is confidential if needs be. At the end of this film, we will be supplying details of the organisations and agencies who can provide support.
Cameron, I recently took a call in the office from a lady who was very concerned because she's struggling to look after herself. She was struggling whilst her partner was away and even during the time when he came back on leave.
You have that primary role of being the caregiver, and it even has a name. We call it the caregiver burden. Sometimes people can have quite unrealistic ideas on what leave is going to be, on both sides. And it's important that you sit down and discuss this together, what you're going to get out of leave. It's also important that the things you did before you continue to do. So if you had your hobbies, if you went and saw people, continue to do that. It's important. And perhaps even looking at some physical exercise, a bit of walking, cycling, gym works fine. But do something that's for you, that's special for you.
There is a lot of support out there for personnel and families, but perhaps family members don't know what's available and how to access it.
Around the UK we've got 15 departments of community mental health, all of which are now under the lead service of Army Primary Healthcare. We have those departments staffed by both military and civilian personnel. And within a number of those departments they will have other specialists. We'll have psychologists in the DCMHs, we'll have mental health social workers, we'll have consultant psychiatrists and nurses of varying degrees of skills and expertise. Each new referral will be seen within a 20-day working window from the point of the referral reaching the department. In the majority of cases, they will be seen within their own unit, because we like to see people within their own working environments, ideally. What we want to do is to say good mental health is for everybody, because if you're able to talk about it and get the right help at the right time, then it's much easier to resolve the problem, get them the right treatment and get them back to full fitness.
Cameron, there seems to be a sense of reservation from some people about approaching welfare service, predominantly because they sense they can't trust it.
The aid that is offered by the RM Welfare and the MPFS is first class. They're all well-trained professionals, they work to a strict code of conduct, and they will give you a bespoke response to what you actually require. It's at these times that it's really important that you don't isolate yourself and you don't refuse help when it's there on offer.
How would you advise family members who are perhaps feeling a little bit low, perhaps having